Hello and welcome to a talk about addictions and how addictions influence us and what to look for. My name is Mike Meyer. I'm a licensed counselor both in addictions and in mental health. And addictions is what I started studying a little bit more than 20 years ago. And I'm an unapologetic deadhead who was wandering around Grateful Dead shows, watching a lot of intensive psychedelics and drug use there. And I developed a real fascination and interest in addictions. And fast forward to over 20 years later, and our culture is struggling right now with many addictions problems of all kinds. And I'd like to say a few words about addictions and what to look for, and maybe take a few steps back into what addictions are and how at least we define them clinically, and then how to maybe go forward from there. So addictions can be in several categories, and often we refer to substance abuse when we talk about addictions, and that's certainly one of the bigger categories right now. And we have some overuse right now of fentanyl and some very deadly drugs. But there's all kinds of addictions of what might seem like benign or other types of behavioral addictions as well. So everything from shopping to technology and just of various types of behavioral addictions, sex addictions, things like that, are also culturally very common. So that being said, I want to impart the idea that addictions are understandable. They're often stigmatized. They're looked at in a punishment way, a punitive approach to addictions. And I'm here to say that most of us have some sort of addiction of one type or another, and that they're an understandable response to not feeling well, often. So there's a poem by Charles Bukowski that really touched me. I only heard this yesterday and wanted to bring this in. And this, I think, captures the feeling that I know that I've gone through. And this is about, I think it's called Bluebird. And Bukowski says, "There's a bluebird in my heart, but I'm too tough for him. I say, stay in there. I'm not going to let anybody see you. There's a bluebird in my heart. And I pour whiskey on him and inhale cigarette smoke." That's the beginning of the poem. And it goes on to tell about how he's going to be tough and keep that innate, loving, and kind and caring part of us at bay. And we often don't know why we're doing it. We often don't know why we slip into addictions. And yet, some of it is to keep from being vulnerable, as the poem illustrates. And this is a difficult society to be vulnerable in. So I'm here to say vulnerability only comes little by little, that we can't force it, and yet we all have to acknowledge it and experience it. So back to definitions of addictions. Addiction tends to come into three categories: the use of a substance or a behavior, the abuse of the substance or behavior, and then there's dependence, where it becomes chronic and regular. So the abuse of a substance can be sporadic, and sometimes people can do that without developing tolerance or withdrawal symptoms, which are two other things to look for in addictions: when it's hard to come off the substance and when we get used to it. So, in a medical setting, one of the things we look for is when this behavior or substance started at an early age, and that will indicate that it'll be that much more difficult to come off of. So with that, looking for help is key, and I'm going to end this talk on how to look for help and ask for help, because that's a very difficult thing for people to do, and I know it is for me. So the roots of addictions can be embedded in trauma, in isolation, and or in cultural influences. And yet often they're ascribed to us as our fault, as an individual failing, resulting in a stigma, and on it goes. Fortunately, we're finding out that this is a medical problem, not a punitive one. I can't say that often enough. I'd like to tell you a little story about a study, and this is my favorite study of all time. Once upon a time, there were rats in a cage, and they were fed two types of water, pure water and also cocaine water. And the rats would repeatedly choose the cocaine water. And a brilliant researcher asked the question, what if we had the rats' needs met by soft ground, and especially other rats, by being in what they called a rat park? So they actually devised a rat park for these rats to have their needs met. And then they brought them back to the choice between water and cocaine water. And they weren't interested in the cocaine water. The pure water was their choice. That's an example of how we can be affected by culture and by disconnection and making choices that are more about grasping than grounded, rooted choices in who we are. So we need a compassionate approach to addictions. We need each other. We need to ask for help. Some of that help takes different forms. One of the more common or well-known forms is in support groups and in 12-step groups. And these are found in Alcoholics Anonymous and Narcotics Anonymous. And there are other types of 12-step groups available also, and non-12-step groups. So now we have, in this region, we have something called refuge recovery, which is more of a mindfulness and a Buddhist-based approach to recovery. And meditation is where they start. 25 minutes of meditation together. And the feeling of being together in that room, even in silence, is a beautiful way to support and recover from addictions. And then, of course, self-care, taking care of our own personal and internal needs, is extremely important. And keeping up with that. Nutrition, exercise, kindness to ourselves, compassion, these are all especially important when we do find ourselves in the throes of patterning in unhealthy ways. Mindfulness itself is a wonderful practice to become present with the dysregulation that we can feel sometimes internally and in our physiology that addictions can sometimes point to. And of course, seeking treatment. Treatment is available in our community, and asking for help, getting on waiting lists if there are waiting lists sooner rather than later. And then going right into treatment. And there's different types of treatment. There's short-term or outpatient treatment. There's inpatient treatment. There's hospitalization, etc. So finding the level of care that matches what your needs are. And professionals can tell you what that level of care is and make referrals accordingly. One thing I'm sometimes asked about with addictions is what a gateway drug is. And marijuana was often seen as a gateway drug in the past. Almost any substance has been seen as a gateway drug. And I think it's important to comment that prescriptions and opiates can sometimes be a gateway drug, because we had an opiate crisis in this country. And I shouldn't have said that past tense, because we still do. Opiates are often overprescribed. And it's really good to share the information of what your medical history is with prescriptions if you're seeking help. Many of us now know somebody who has died from fentanyl. And the stakes are much higher now. Fentanyl has intruded into our most vulnerable places, into the streets, into places where we're at risk anyway. And fentanyl is very deadly. Just a small, tiny amount of it can be deadly. And it's a concentrated form of opiates that is cheap, and that's often why it's added to a variety of drugs, not just opiates. You can find fentanyl in just about any substance right now. So it's especially important to know where substances come from if you're going to be using them. And towards that, there's this idea of harm reduction versus abstinence, and two very legitimate ways of approaching addiction. Harm reduction is the idea that we use in decreased amounts without giving up completely. Something like needle exchange would be an example of harm reduction, where we search for clean needles in order to make injections towards that dependence on substances. Whereas abstinence is, of course, the absolute quitting of substances, and a very valid approach and a very necessary approach, and especially in severe situations. So be sure you talk to a professional about those options, and talk to someone who does understand what harm reduction means, because sometimes that is stigmatized and not fully understood. And studies show that harm reduction can be very effective. So I want to end this on a couple of ideas. First and foremost, the courageous act of asking for help. Asking for help can start by going to entrusted friends and maybe getting some allies in how to ask for help, and getting some encouragement, and knowing that you are loved, that there is love out there, and that you are seen with compassion and care in your addiction in this day and age. We've learned a lot about addiction, and we know that this is not a personal failing. It's a complicated and a difficult situation that is often seen as a disease that we're going through on a human level. And so we need other humans to get together and care about each other, and it is available. And the results are extraordinary when you tackle addictions in groups and with the courage of sharing your story with other people. So addictions also can be a bigger indication of how to reconnect with yourself. And it may be an indication that you want to come back home into your own heart and soul and do that very courageous act of trusting yourself. And if you have a history of substance abuse, please watch the internal critic. Don't let the critic have any voice, because there's no judgment. As a matter of fact, some of the most educated, wise, amazing people I know are the ones who have gone through the most harrowing addiction stories. So your personal experience matters, and that's how you're seen, and that's who you are, that's who we love, and I trust you to find help. And thanks for trusting me with this information, and I look forward to seeing you soon. Thanks.